Hey everyone, it's Megan and I'm doing my discussion post 1. This week our question is, acute coronary syndrome includes the diagnosis of unstable angina, non-ST segment elevation myocardial infarction, and ST elevation myocardial infarction. It says, in your readings this week related to a patient experiencing a STEMI, which is, why is time is muscle so important? Base your discussion response on the pathophysiologic changes that occur when a person's experiencing a STEMI. So after doing our reading, we understand that myocardial ischemia refers to the condition where the heart is receiving an insufficient amount of oxygen to meet its metabolic demands. This occurs when there's an imbalance between oxygen supply and oxygen demand in the myocardial cells. Coronary artery disease, as we've learned, is one of the leading causes of mortality in the United States, and having understood this, it's very important for us as nurses to know that why this is happening in the body. According to our textbooks, one of the defining characteristics is the narrowing or occlusion of one or more coronary arteries. Depending on whether or not it is narrowing or being occluded completely will relate to the patient's symptoms and diagnosis of either angina pectoris or an MI. And this can be found in our Heinrich textbook. Common medications used to treat that are are nitrates, calcium channel blockers, and beta blockers. In an MI, we see the time is heart, saying in the fact that there's advanced form of CAD. This atherosclerotic plaque accumulates in the endothelial wall of one or more branches of a coronary artery. These pieces dislodge and rupture in small vessels serving a portion of the myocardium. The clotting begins, and the vessel begins to become completely obstructed. This leads to a decreased and inadequate supply of oxygen to the heart muscle, which shifts the myocytes to anaerobic metabolism after only 8 to 10 seconds of oxygen loss. This form of metabolism is ineffective and does not produce enough energy to keep the heart beating. Lactic acid builds up, creating a metabolic acidosis, which suppresses the contractility and diminishes heart function. All of this information can be found in our textbook by Carol Heinrich on page 240. But understanding that that's what's happening in the body shows us that the fast-acting ischemia is taking place, allowing us to understand that the term that time is heart is that the ischemia tissue is ineffective, dead tissue that can no longer function as a normal portion of the heart muscle, and therefore treating it medically is very important to prevent further ischemia to the heart muscle and preserve as much as we can to preserve as much functional heart as we can. And that's my discussion post. Thanks.